Today, we're diving into something that feels like a pivotal moment in global health. For decades, how we thought about obesity was often pretty simple, right? Calories in, calories out.
Yeah, basically. And the solutions.
Yeah.
Mostly diet, exercise, and then, for severe cases, bariatric surgery.
Right. Those were the tools. But what we're seeing now, it feels like a completely different game.
It really is a profound paradigm shift,
Yeah.
actually. We're moving way beyond that simpler view because the science is unlocking totally different ways to think about intervention.
It's like there's this huge battle going on, maybe a revolution even, but the weapons are just evolving incredibly fast. I mean, we've got these powerful new medications changing lives.
Absolutely.
And then looking further out, there's this almost sci-fi promise of genetic engineering. So this deep dive, it isn't just about saying, okay, this one's the winner. It's more about understanding how all these things together are like reshaping the whole landscape of weight management.
Exactly. Our goal here is to sort of guide you through the strengths, the challenges that are popping up, and honestly, the mind-boggling potential of these main players.
Yeah, boil it down so you can really get a handle on this field, because it is moving fast.
Well, distill the key info, yeah. Help you get informed quickly and hopefully thoroughly.
Okay, so let's start with the one that's been around the longest, the established champion, you could say, bariatric surgery. The real heavy hitter for decades.
Indeed, yeah, bariatric surgery. It's about surgically altering the digestive system. And that's not just to limit how much food you can take in, though that's part of it.
Okay.
Crucially, it also profoundly changes the gut hormones, the ones that affect feeling full and your metabolism. Think about things like the gastric sleeve.
Right, where they reduce the stomach size.
Exactly. Or gastric bypass, which actually reroutes things more significantly in the digestive tract.
So it's doing more than just like physically stopping you eating as much. There's a deeper biological thing happening.
Oh, absolutely. A deep physiological impact.
And who is this really the best option for? Who sees the biggest benefit?
Well, its effectiveness for people with severe obesity is frankly unparalleled. We're usually talking about folks with a BMI body mass index over 40.
Okay.
Or maybe over 35 if they also have serious weight-related health problems like diabetes or sleep apnea. For that group, it just consistently delivers the biggest, most lasting weight loss.
And what kind of numbers are we talking? Like how much weight loss and what does that do for their health overall?
Patients can lose often between 50 to 70% of their excess body weight, which is huge.
Wow, yeah.
And the health improvements follow. They're often dramatic. We see big reductions, sometimes even full remission of type 2 diabetes, high blood pressure, sleep apnea.
Remission, really?
Yes, quite often for type 2 diabetes, for example.
Yeah.
And what's particularly striking is how durable it can be. Many people keep a significant amount of that weight off for years and years.
That sounds incredibly life-changing for the right person.
Yeah.
But it is maker surgery. What are the trade-offs, the risks?
Well, yeah, it absolutely is a major life-altering operation. So there are inherent risks, things like infections, blood clots are possibilities. And then there are potential long-term complications too. Things like nutritional deficiencies because you're absorbing nutrients differently, or sometimes bowel obstructions down the line.
And I guess it's not just the surgery itself. It's not like have the operation, then you're done. There's a big commitment afterwards, right?
Oh, absolutely. A huge ongoing commitment. Patients have to commit to lifelong dietary changes, really significant ones. And often they need vitamin and mineral supplements for life.
Okay.
And then there are the practical things. The cost can be really high, tens of thousands of dollars often. Plus, the eligibility requirements are quite strict. So it's not something everyone who might benefit can actually access.
Right, got it. Okay, so that's the veteran. Now let's shift gears completely. Let's talk about these newer weight loss medications, the ones causing such a stir, the GLP-1 revolution. Because, let's be honest, for years, diet pills were, well, pretty underwhelming.
That's a very fair way to put it, yeah. The history wasn't great. Limited results, often side effects that were problematic. But then came the GLP-1 receptor agonists. That's glucagon-like peptide 1.
Okay.
And that just fundamentally changed everything. Drugs like Wegovy, that's semaglutide, and Zepbound, which is tirzepatide, they've been genuinely transformative for many people.
So what are they actually doing that makes them so different, so much more effective than the older stuff?
They're actually quite sophisticated. They're injectable medications mostly that mimic natural hormones your gut produces.
Okay.
These hormones do a couple of key things. They send signals to your brain saying, hey, you're full, and they also slow down how quickly your stomach empties.
Ah,
So it
okay.
leads to this natural feeling of reduced appetite, meaning you eat less, fewer calories. They're basically tapping into and kind of boosting the body's own system for regulating hunger.
Right, using the body's own signals. And the results, again, they sound incredible. Clinical trials showing average weight loss of, 15%, sometimes over 20%.
Yeah, 15% up to over 22% in some studies with tirzepatide. It's really impressive. But, and this is important, the story isn't just about the number on the scale.
Right, what else is going on?
Well, these aren't just, weight loss drugs. They're kind of revealing how obesity is tied into the whole metabolic system. We're seeing really significant improvements in cardiovascular health markers, kidney function,
Oh, interesting.
which makes them attractive for a much wider range of reasons. They offer this highly effective option that isn't surgery, and there are oral versions being developed too, which could make them even more accessible.
So a powerful alternative, but what about the downsides? What are the main side effects or challenges people are finding?
The most common things are definitely gastrointestinal issues.
Yeah.
So nausea, sometimes vomiting, diarrhea, constipation, especially when you first start the medication or when the dose increases.
Okay, usually manageable.
For many, yes, they tend to lessen over time, but they can be unpleasant. There's also this other concern about losing muscle mass along with the fat. That's something researchers are looking at closely now.
Right, you want to lose fat, not muscle.
Exactly. And then, of course, there's the cost. It's a huge barrier. Without good insurance, these drugs can cost over $1,000 a month. Easily.
Oof. Yeah, that's significant, and that brings up this other huge question. Permanence. Are these something you have to take forever?
That seems to be the critical point emerging. Studies are showing pretty clearly that when people stop taking the medication, most of them regain a significant amount of the weight they lost,
Ah.
which strongly suggests that for many people, this might need to be a lifelong treatment because we're increasingly understanding obesity itself as a chronic condition, like high blood pressure or diabetes.
So it's managing a chronic condition, not necessarily a cure.
That seems to be the way it's heading, yes. And you can imagine long-term adherence. Taking injections every week or every day for years, that could be a real challenge for people.
Yeah, psychologically too, I imagine.
Definitely. We hear about that. Even people getting great results find the idea of lifelong injections a bit daunting.
And it also makes you think about the bigger picture, doesn't it? How does society adapt if millions of people start using a medical fix for something that's tangled up with lifestyle, environment, everything else?
It absolutely does change the conversation. The potential scale of use, it brings up totally new questions for healthcare systems, for how we think about weight management going forward.
Okay. So from these game-changing drugs that are here now, let's take a big leap. Let's talk about maybe the dark horse, the really future contender, genetic engineering. The idea here sounds almost like science fiction, right? A single treatment that could maybe edit your genes so you're just resistant to gaining weight.
It's definitely the ultimate frontier, you could say. Scientists are getting much better at identifying specific genes that play big roles in appetite, metabolism. Things like the MC4R gene or the FTO gene, which is linked to fat mass. And the idea is that technologies like CRISPR, the gene editing tool, could theoretically be used to target those genes, to correct them or alter them in a way that promotes weight loss or even stops obesity developing in the first place.
Wow. So like rewriting your body's basic metabolic code. Have we seen anything that suggests this isn't just pure fantasy? Any early wins?
Well, early research, mostly in animal models so far, has shown some really remarkable promise.
Like what?
Gene therapies have led to reduced weight in animals, improved metabolism, even converting the typical fat-storing white fat cells into the more calorie-burning brown fat cell.
Oh, interesting. Brown fat burns energy, right?
Exactly. So the ultimate goal, the dream really, would be a permanent, targeted fix. Minimal ongoing effort needed from the patient after the treatment.
That really does sound revolutionary. Okay, but what's the big reality check here? How far off is this?
Yeah, the reality check is crucial. We're likely decades away from this being a widespread available thing for the general public.
Decades.
Okay. Not next year then. Definitely not. I mean, the science is just incredibly complex. Making sure it's safe, making sure it's precise enough in humans, that's a monumental task. The risk of unintended consequences, what they call off-target effects, is huge when you're editing genes.
And you can't really undo it easily, I imagine.
Precisely. And then beyond the pure science, you get into these profound ethical questions, don't you?
Yeah, absolutely. Like what?
Well, questions about fairness, who gets access to this, what happens if only the wealthy can afford it, unforeseen societal impacts, and even defining the line between treating a disease versus, enhancing human traits. Where does weight management fit?
Right. Is it treatment or enhancement?
Yeah.
Big questions.
Huge. And of course, the cost, initially at least, for any kind of bespoke genetic therapy would be astronomical.
Okay. So we've looked at the veteran champion surgery, the revolutionary new kid on the block, the GLP-1 meds, and this distant, maybe ultimate future contender, genetic engineering. So the big question, who wins? Who takes the crown in this race?
Well, the verdict seems pretty clear already, actually. There isn't going to be one single winner. It's not really that kind of race. Instead, what we're heading towards is a future where all these different approaches have a really crucial and probably complementary role to play. It's going to be about a much more personalized approach to managing weight.
So bariatric surgery isn't going away then? It's not becoming obsolete because of the drugs?
Oh, far from it. No.
Yeah.
It will likely remain the absolute champion for individuals with severe obesity, people who need the most profound, the most lasting results, especially if other things haven't worked or aren't enough.
Yeah.
It has that proven long-term track record.
Okay. And the GLP-1 medications, the ones making all the headlines now, where do they fit in long-term?
They are definitely the current frontrunners for a much broader group of people. Their effectiveness, combined with being less invasive than surgery, makes them incredibly powerful tools. And as the costs hopefully come down, and as oral versions become widely available, their reach is just going to expand massively. They'll likely become a primary medical treatment for obesity, maybe even a first-line therapy for many.
Okay. And genetic engineering. That's
Yeah.
sort of long-term promise.
That's the ultimate frontier, really. It's not an immediate solution, obviously, but it's potential. I mean, the potential to offer a permanent, maybe even preventative cure for certain types of obesity is just unparalleled. It really represents personalized medicine at its most fundamental level, the idea of actually rewriting our metabolic predispositions.
So the race isn't really about one approach beating the others.
Right.
It's more about having this expanding toolkit, an arsenal of options.
Precisely. That's exactly it. The ultimate victory, the real win, will be a future where obesity isn't this runaway global epidemic anymore, but it's a manageable condition.
Right.
A condition with a diverse range of effective, accessible treatments that can be tailored to each person's unique biology, their circumstances, everything.
And that shift in thinking, that itself feels like a huge win, moving away from that simplistic, sometimes judgmental, just eat less, move more idea.
Well, absolutely.
Towards understanding obesity as this complex metabolic disease, that deeper biological understanding. Maybe that's the biggest breakthrough of all.
I think you're right. It allows us to finally approach it with the scientific rigor and the seriousness it deserves, just like we approach any other major chronic disease.
So we've just covered an incredible amount of ground here, this massive expansion of options in the fight against obesity, from surgery, these transformative meds, to the tantalizing future of genetic cures.
It's a field that is just evolving at an incredible pace. It really offers a lot of hope for millions of people.
It really does. And as we think about these really sophisticated biological, even genetic interventions coming, it does leave you with a pretty profound thought, doesn't it? What does all this mean for how we understand things like personal responsibility versus medical intervention when it comes to our health? How do we balance those? And how is society going to adapt to these potentially revolutionary changes in tackling one of our biggest health challenges?
Yeah, those aren't just scientific questions anymore, are they? They're big societal questions we're all going to have to grapple with.
Indeed. Lots to think about. We definitely encourage you to continue your own deep dive into this incredibly dynamic and, frankly, vital field.